Middle-income families will spend about $250,000 to raise a child born in 2012. The Agriculture Department's annual cost of raising a child index is up about 2.5% from a year earlier, and that total just covers costs through age 18. A nonpartisan study says about half the people who now buy their own health insurance would qualify for federal tax credits to offset higher Obamacare rates. That means about half will not and could end up paying higher premiums. It's just one of the many frustrations opponents have with the law. Chief National Correspondent Jim Engel tonight tells us about another.
Senate Democratic leader Harry Reid recently made clear what conservatives have long suspected, that he and other Democrats, including the president and key officials, see Obamacare as a stepping stone to single-payer, government-controlled health care.
Don't think we didn't have a tremendous number of people who wanted a single-payer system.
So why didn't it happen?
Well, you have to get a majority of the votes. We weren't able to do that.
I think that the idea of moving towards a single-payer system could very well make sense. That's the kind of system that you have in most industrialized countries around the world.
I'm all for a single-payer system eventually. I think what we have to do, though, is work with what we've got to close the gap.
But what do people mean when they use the term single-payer?
What they really mean is putting everybody into one big government insurance program, and almost always on the left they're talking about Medicare.
Medicare does pretty well, considering it's only $42 trillion in debt by the most optimistic scenarios. So I'm not sure that I would want to pile a whole bunch of more people onto that particular Titanic.
And analysts note single-payer systems in other countries do hold down costs, but by rationing care.
If you look to, say, Great Britain, there's about 115,000 people there today who have been waiting longer than 18 weeks for admission to the hospitals. In Canada, the waiting list to get in to see a physician of your choice can be as many as 800,000 people at any one time.
The typical wait for a normal procedure in Canada is 4 months. For a hip replacement or a knee replacement, the wait is 10 months.
In fact, some people in great pain or even with serious illnesses are forced to wait.
No less than the Supreme Court of Canada in 2005, as part of a ruling in the case of Chihuly versus Quebec, said that some people in Canada died as a result of being on the waiting list.
Those are some of the reasons advocates of a single-payer plan have been unable to round up the votes to put it into law. Shannon?
Jim Engel, thank you.